Welcome to Lab Day 3. Alright, first we're gonna look for your external occipital protuberance. This is a little bone that sticks out in the back of your head. When you come to search for it on a female, you remove their hair, and then you'll just, well, she got a ponytail, but you'll just basically feel down, and then it'll just be a little bump on the back of the head. Next, we're gonna go with the mastoid process. Just this little bone sticks out right here. And when you find it on here, it's gonna be right behind the ear. You feel a little bone sticking out. Alright, now we're gonna be talking about our pelvis or hip bone. First we have the iliac crest, just the crest of the bone. We have the ASIS, the anterior superior iliac spine. We have the pieces, the posterior superior iliac spine, and we have the ischial tuberosity, which is your tailbone or butt. All right. Now on my patient, is it okay if I place my hands on your hips?
Yes.
So for the iliac crest, you just feel right here, and it's just a crest. You feel the crest. For the anterior superior iliac spine, you'll get the crest, and you'll just go right to the front, and you'll feel it sticking out a little bit. For the posterior superior iliac spine, the way I like to remember, it's just the back dimples, or where your back dimples are usually at. For her, she has back dimples, kinda, so it's pretty easy. Or you can just feel it, and then where your thumbs are, pretty much be where it's at. And then for the ischial tuberosity, I will have her put her foot on here, feel it better, and it's just gonna be your little bone that sticks out when you're sitting down.
And now for the lower extremities.
Alright, so we're going to be talking about the femur. For the femur, we are going to be talking about the greater trochanter, which is right here. You have your medial and lateral condyles, which is, this is the medial condyle, it's the lateral condyle. The epicondyles are a little bit more up. So you have the medial epicondyle, will be in this general area. The lateral epicondyle. We have the abductor tubercle, just right here. Just a little bump. And then the patella, which is a little rock. Boom. Now to point out the landmarks of the femur on my patient, I will demonstrate. For the greater trochanter, is it okay if I place my hands on your hips?
Yes.
An easy way to do it while she's standing up. You put your hands here, feel, and as she's going side to side, you'll feel the bone stick out. So she's going to the right side, this will stick out this way. She's going to the left side, it will stick out this way. Alright? For the medial and lateral condyles and epicondyles, I'm going to have her sitting down. So the easiest way to do it, just find your epiphyseal line. Alright, and it's the condyles and epicondyles for the femur are just going to be right on top. So for this one, the regular condyles, just go right up. Feel it right here. For the epicondyles, just go up a little bit more. And then you have your abductor tubercle. I'm going to have her lay down. And basically what you're going to do is, just going to feel it, and you're just going to dig in like you will with your coracoid process, and you'll just feel in there until you feel it. It should be like right in here. And then the patella, which is pretty easy, it's just your kneecap. Next we will be talking about the tibia.
And the fibula.
For the tibia, we have your medial condyle, your lateral condyle. Little bump is the tibial tuberosity. The shaft is the whole thing. And then the medial malleolus, which is your ankle bone that sticks out on the medial side. Now for the fibula, you have the head of the fibula, and then the lateral malleolus, which is the lateral side of your little ankle bone that sticks out. On my patient, I will demonstrate. So for the tibia, we'll do the same thing. We'll find our epiphyseal line, and instead of going up for the femur, we're just going to go down. You have the medial and lateral. You have your tibial tuberosity, just a little bump right here. You have your medial malleolus, just a little ankle bone. You have the shaft, just do that. And then the head of the fibula, you'll go back to your line, go back to your epicondyle, and then you'll go to the lateral side. And it has to be on the outside for it to be lateral, not over here because that's still anterior. be the outside right here. And then the lateral malleolus, which is your lateral ankle bone that sticks out.